Okay, good afternoon. We are going to take a new topic, bleeding disorder. So the first one is take thrombocytopenia. Are you about the thrombocytopenia? Okay, thrombocytopenia is a condition characterized by low platelet count in the blood. Normally, the platelet count is 1,50,000 to 4,50,000 platelet per microliter per blood. But thrombocytopenia is a condition. It is characterized by the low platelet count in blood. Okay. നമ്മുടെ രക്തത്തിൽ പ്ലേറ്റ്ലെറ്റ് കൗണ്ട് കുറയുന്നതിനെയാണ് എന്ത് പറയുന്നത് thrombocytopenia. Etiology of thrombocytopenia. There are two etiological I will list down. First one is increased destruction and decreased production of platelet. That will lead to thrombocytopenia. The increased destruction can again divided into two types. First one is immune and second one is non-immune. Okay, we can go through increased destruction, that is immune. Okay, the first one is you can go through the points. I can show you the first one is immune thrombocytopenic purpura, that is known as ITP. Second one is heparin induced thrombocytopenia, that is HIT. Drug induced antibodies, HIV. Post transfusion purpura. Connective tissue diseases, thyroid disease, these are included in the increased destruction that related to immune. Second one is increased destruction related to non-immune, that mainly include DIC, that is disseminated intravascular coagulopathy, thrombotic thrombocytopenic purpura, that is TTP, hemolytic uremic syndrome, HUS. These are including increased destruction, non-immune. Then go to decreased production. What are the conditions that will lead to decreased production of platelets? Mainly the hematological malignancies, bone marrow failure is we know aplastic anemia. There is RBC-WBC platelets completely decreases. That pancytopenia. അതിനെയാണ് പറയുന്നത് pancytopenia. So in bone marrow failure, pancytopenia will be occur. That is one of the reasons for decreased production of platelet. Ineffective hematopoiesis, no proper hematopoiesis, that is myelodysplasia. Marrow depression by radiation, chemotherapy, alcohol, medication. Then some infections like measles infection, HIV infections. Then hereditary thrombocytopenia in pediatric population. Marrow infiltration by metastatic cancer, vitamin B12 deficiency, folic acid deficiency, that will lead to decreased production of platelets. So overall we are giving the information about this increased destruction mainly by the immune thrombocytopenia purpura, that is immune. Then drug induced antibiotic HIV, post transfusion purpura, typhoid disorder. Then HIT, that is heparin induced thrombocytopenia. In the case of non-immune, there is a DIC, disseminated intravascular coagulation, thrombocytopenic purpura, that is TTP, then hemolytic uremic syndrome, HUS. Okay, we can go to the next topic. നമുക്കതൊന്നും കൂടി വിശദമായിട്ട് പഠിക്കാം അല്ലേ. എന്താണ് ഇമ്മ്യൂൺ ത്രോംബോസൈറ്റോപീനിക് പർപ്യൂറ? ഞാൻ ആദ്യം തന്നെ പറഞ്ഞായിരുന്നു ഇതൊരു ഇമ്മ്യൂൺ മീഡിയേറ്ററാണ് അല്ലേ. thrombocytopenic purpura ആണ്. So normally the thrombocytopenic platelet are coated by the antibodies within normal function, but when this platelet go to the spleen where macrophages are there, so it will destroyed by the macrophages, and because of thrombocytopenic platelets are structured by the altered by the coated antibodies. Antibody coated thrombocytic platelets ഒക്കെ എന്ത് ചെയ്യുന്നുണ്ട്, അതിൻ്റെ സ്ട്രക്ചർ തന്നെ മാറിപ്പോയി by coated by these antibodies. So macrophages, it will recognize it as a foreign body. Finally it will engulf the thrombocytopenic platelet, will lead to thrombocytopenia. Normally the platelet life is 8 to 10 days, but in thrombocytopenia there is 1 to 3 days. Okay. So what is immune thrombocytopenic purpura? Nothing but it is an immune mediated, where normally the thrombocytopenic platelet will coated by the antibodies with the normal function, but when this platelet reaches to the spleen, where it will destroyed by the macrophages, because the macrophages, the thrombocytic platelets is structure is altered by the coated antibodies, so it will recognize a foreign body. Finally the platelet life will be decreases 1 to 3 days. Okay, normally the platelet life is 8 to 10 days, but in the case of immune thrombocytopenic purpura the platelet life cycle is decreases to 1 to 3 days. Okay. Thrombotic thrombocytopenic purpura. What do you mean by thrombotic thrombocytopenic purpura? It is mainly occurred due to the deficiency of the plasma enzymes. Which plasma enzymes? The plasma enzymes known as the Adam TS13. Okay, due to this plasma enzyme, this thrombotic thrombocytopenic purpura will happen. Okay, normally these enzymes helps to break down 1 millibrand clotting factor into normal size. 1 millibrand, it will, the Adam TS13 usually break down to 1 millibrand clotting factor into normal size. So this deficiency of plasma enzyme leads to thrombotic thrombocytopenic purpura. Okay. Next one is heparin-induced thrombocytopenia and thrombosis syndrome. അതിൽ പേര് തന്നെ ഉണ്ടല്ലേ, due to increased use of heparin. Normally the platelet factor 4 bind to the heparin. This complex bind to platelet surface, leading to further platelet activation and release of more PF cause positive feedback loop, leads to arteriovenous thrombosis, pulmonary embolism, stroke. ഇതിലൊന്നുമില്ല, platelet factor 4 normally bind to heparin. This complex is again bind to another platelets and leading to further platelets activation and release of more PF and further attachment to more heparin. So it is a formation of a loop or positive feedback loop is formed, and finally the thrombus is formed. The complication of stroke, pulmonary embolism will be happen. So heparin induced thrombocytopenic and thrombosis syndrome due to increased use of heparin. What are the clinical manifestation? It is a platelet decrease in so bleeding problems now. Purple brown, petechiae, purpura, prolonged bleeding, even minor cut. If you have a minor cut, there is a bleeding will be occurs. So bleeding from the nose will be occurs, mouth will be occur. Some especially females vaginal menstrual bleeding is abnormal. Bleeding after surgery, a small surgery or procedure, the bleeding will be occur in the site. Blood in urine, stool in urine, headache will be happen, neurological symptoms. These are the clinical manifestation. The main diagnostic measures are, first one is the history collection, then physical examinations. I already mentioned about the physical signs. Then go to blood test like platelets, CBC, ESR, liver enzyme, folic acid, peripheral blood smear. Bone marrow biopsy cause leukemia, aplastic anemia, prothrombin time, ITP antigen specific assay, platelet activation assay for HIT, increased LDH, lactate dehydrogenase in the blood. Now we can go to the management. Immune thrombocytopenic purpura we are managed with a corticosteroid, platelet transfusion, though there is a decreased platelets, so platelet transfusion, splenectomy will be done. Then IV immunoglobulin, dinosaur, immunosuppressives such as cyclosporin, phosphate, these are mainly given. Thrombotic thrombocytopenic purpura, corticosteroid we are used in the initial stage. Plasmapheresis is another method. Splenectomy, Daxtran, chemotherapy like vincristine, immunotherapy like cyclophosphamide. These are the management. Heparin-induced thrombocytopenia. ഇവിടെ ശ്രദ്ധിക്കേണ്ട ഒരു കാര്യം, stop the heparin. Okay, the patient is currently taking any heparin, so patient is stop the heparin, discontinue the heparin, start direct thrombin inhibitors like a lepirodin or argatroban. Then plasmapheresis will be done. Protamine sulfate, cumidine, the antidote of heparin, that is vitamin K. Protamine sulfate is the antidote of heparin, so it is one of the treatment management method. Cumidine, vitamin K, then thrombolytic agent. Then idiopathic thrombocytopenic purpura, prednisolone, IV immunoglobulin, splenectomy, danazol, and rituximab is a chemotherapy. The nursing management. What are the nursing management we have? Firstly, assess the signs of internal and external bleeding. The main problem is the bleeding, so assess the signs of internal and external bleeding. Observe skin, petechia, purpura. These are bleeding disorders specific signs. Avoid medicine like aspirin, ibuprofen will further bleeding. So avoid this aspirin and ibuprofen. Take doctor about taking vaccine for the virus that affect the platelets. Okay, talk the doctor about taking the vaccines for the virus that affect the platelets. Patient need vaccine for mumps, measles, rubella, chickenpox. Do not participate contact sports like cricket. There are chance of bleeding. Take safety precautions like seat belt wearing, soft brushes. Please take soft brushes and some safety precautions like seat belts in the case of thrombocytopenic patients. Use soft brushes, please, because uh, gum bleeding will be happened. So use soft brushes. Walk with the shoes or slippers. Use electric razor in order to prevent the bleeding. Don't use blade. Blade will make a small cut and finally the bleeding will be happened. Don't pluck eyebrows. Even small ear eyebrows that will also do not pluck. Do not use alcohol based mouthwash. Female aware number of pad during menses. There are menses, there are bleeding will be occur. Female should be aware about the number of pads they are occurring. Do not use this for mouthwash. Then consult the doctor before the dental cleaning because doctor will be understand this condition. You are bleeding. PTI never be checked before consulting the doctor. Okay. Patient education. Educate the patient to avoid NSIDs. Further create a bleeding. Initiate bleeding precautions. Electric razor we can use. It's one of the another method. Limit the alcohol. Avoid contact sports, martial arts. These are very injury making programs. So avoid contact sports and martial arts. Increase intake of green leafy vegetables. Monitor the signs of infections if splenectomy is required. Thank you.